Hello, friends, and welcome once again. It's hard to say how far we are into this pandemic. Some of us have been socially distancing for weeks, and others have started more recently. But now, hopefully, those who are staying at home, which mean you have more time than ever to follow news about the COVID-19 and question about what the future holds. So you have sent me a lot of your questions in emails and voice memos, and today I want to spend some time answering them. So I am Dr. Nayyar Raza, and you are watching my YouTube channel, and this is coronavirus series, Facts versus Fiction. So we start with the first question of the day, and let me go through this first question. And okay, fine. So this first question has been sent by Jason Scott from Watford, and he asks, with so many people touching fresh produce and packages at grocery stores and the markets, what measures need to be taken in protecting consumers from contracting the novel coronavirus? So this is the question that he has asked. Now the answer is, Jason, thank you very much for your question. Now, it's very important to point out that the coronavirus is not a foodborne illness. It's a respiratory illness. So you won't get it from eating food. But experts do recommend that you wipe down the outside of canned or wrapped foods. You should be washing your produce anyway. So keep doing that. And you should also be sure to wash your hands after unpacking your groceries. And by the way, I hope you know the drill. Soap and water for 20 seconds, and don't forget your thumbs. Okay, fine. So let's move on to the second question. And the second question has been sent from Imdadullah from Karachi, Pakistan. And he asks is that my family lives in Karachi, and we were just discussing contingency plans because my mother takes care of my sister kids, plus my brother has a disability. They're all very interconnected. So my question is that if someone does get exposed and get sick, how can they best self-isolate while still under the same roof? So, Imdadullah, thank you very much for your question. This is a hard one, in fact. I mean, if an infected person lives in a shared space, that person should try to keep to a single room as much as possible. The best advice, I guess, comes from the CDC, which is the Center for Disease Control in Atlanta, United States. And they have a really helpful home care guide that suggests some steps for those living with a sick person. So some of the recommended precautions include making sure that shared spaces have good airflow. Make sure that the sick person wears a mask if they are able to, and using disposable gloves to handle potentially contaminated items like tissues or dishes. So I hope this answers your query. Moving on to question number 3. And this question is in Urdu, but let me translate it in English. And the, the sender doesn't want her name to be disclosed, and says that I am one of the nurses here in Lloyd Reading Hospital, Peshawar. How can we be safe in taking care of the ill and sick if we ourselves aren't protected properly? Okay, so the answer is you cannot. Simply, you cannot. That's why this question is crucial and will become even more so as hospitals back in Pakistan attempt to handle the flood of patients because of the increasing incidence of COVID-19. Now, there are several reasons that Pakistan may not have been equipped to handle this outbreak. Now, according to, I would quote an infectious disease expert, his name is Dr. William Schaffner, and he said that there was a global general trend 20 or 30 years ago to underbuild hospital beds because it was always so expensive to build beds that aren't always used. So before that shift, there was generally more hospital beds available than was necessary. So when it comes down to things like masks and gowns, disruption of the international supply chain is largely to blame for this thing. The COVID-19 has slowed or stopped production around the world, and we are just not able to keep up with the demand. Now, unfortunately, hospital stockpile of supplies provided not to be to be big enough to take care of the increasing flood of patients. Now, another thing is that it is true that we have known this pandemic was coming for some time, since January probably. We had a pretty good idea of how many hospital beds we would need, how many ICU beds we would need, and how many ventilators we would need. We also knew how much personal protective equipment would be used in such a scenario. But unfortunately, for many weeks, we didn't do enough to ramp up the supply, and this is one of the reasons that at the moment we are in a situation where we don't have enough PPE for the healthcare staff. Fine. So question number 4 comes from Mark Little from London, and he asks, everybody mentions that most people at risk are elderly and people with pre-existing conditions. But pre-existing conditions is a very broad term. So what does that include? So the answer is Mr. Mark Little. Well, according to, again, I would quote the CDC, Center for Disease Control in Atlanta, USA. Some of the underlying conditions that may put you at higher risk, they include chronic lung disease like COPD, asthma. They also include heart disease, and if somebody is undergoing cancer treatment, that is also a pre-existing condition. Similarly, anyone with diabetes, anyone with kidney failure or liver failure may also be at a higher risk. Now, think of it like in your everyday life, you are always fighting off pathogens. Now, most of the time, you don't even realize that. If you have got an underlying condition, it makes it more challenging to fight off a virus like this. You may develop a fever, you may develop shortness of breath or a cough, and you would do it more easily than someone who doesn't have got a pre-existing illness. And a new study which has recently been conducted that shows that cardiac injury could also be a common condition in hospitalized COVID-19 patients. And since the hospitals in outbreak hotspots, they may become overwhelmed with patients very quickly. So it's important to know what symptoms are serious enough to warrant a hospital visit. Like, for example, if you've got severe shortness of breath along with persistent pain in your chest or pressure in your chest, then you should seek medical attention immediately, and you should immediately contact a doctor. Fine. Now I come to the last question for today. I think this is the 5th question for today, and this is Mr. Rizwan Raja LLB. And Mr. Rizwan Raja LLB from Lahore asks, my question is that sometimes I think it's on a lot of people's mind, and that is, in your medical opinion, how long do you think this outbreak will last? Thank you very much, Mr. Rizwan Raja LLB. Well, answer is, unfortunately, no one can answer that question for sure, because someone had suggested that this outbreak would subside during the warmer months, but so far there is no proof of that. I mean, that's still spreading even in the month of June. You can see the number of cases is on rise in Pakistan, and the temperatures are already touching past 40 degrees Celsius. Scientists say it's too early to tell how or when the pandemic could truly end. So very difficult to answer that one. And in fact, I first heard this might be a recurrent seasonal illness back in February, when I heard the interview of the director of Center for Disease Control in United States of America. And similarly, we have listened to some other experts as well, and they say it's very difficult. It might be here to stay for another 12 to 18 months probably, and we have to see how the situation unfolds in the future. But at the moment, looking at the trends, the number of cases are still increasing globally, though in most of the countries, we have reached a plateau, and there is a very slow, steady decline. But then there have been some recent other hotspots around the globe, like Pakistan, India, and some other countries, African countries, where the number of cases are steadily increasing. So very difficult to answer this question. Probably it's going to stay for a while. My own guess is probably 12 to 18 months. But still, it has to be seen. It's just like any other wild guess. So I hope that answers. So these were the 4 or 5 questions that I was asked recently, and I hope I've tried my level best to answer these questions to the best of my knowledge. Do keep asking. I like when people ask questions, and I would like to answer as much as possible. So thank you very much. Keep watching my channel. Do subscribe to my channel, and if there are any further questions, just put down in the comment section below. Thank you very much. Bye bye.